Hello and welcome. I see that we have people gathering for today's At Home Together. I'll just wait a few more minutes for people to have a chance to finish signing on and joining us. We have a record turnout for this evening's program, and we're thrilled to have all of you. We'll start in just in a minute here. Okay, I hope everyone's had a chance to sign on. Welcome to this month's At Home Together program. I'm Trixie Ann Goldberg, Development Director with Academic Medicine here at Banner Health Foundation. Thank you to Prisma, the sponsor of our At Home Together series. Mr. Kiyosaki was not able to join us today, but sends his regards. A few housekeeping items for today's program. We are being recorded and the audience is on mute. Viewers can adjust your own Zoom view setting if you'd like to find the setting that works best for you, such as side-by-side and speaker view. There will be time for questions today during our program. If you're invited to use the chat icon to enter your questions at any time, we will attempt to get them all in, but don't worry, we will respond to all of them later on after the program on our landing page as well too. I'm so pleased to be welcoming Dr. Gopalan to our At Home Together, well, actually back to our At Home Together series. Dr. Gopalan is Medical Director for the Center for Advanced Heart Failure, Mechanical Circulatory Support, and Heart Transplant at Banner University Medical Center, Phoenix, which many of us still know as Good Sam. As a recognized leader in the integration of Eastern and Western medicine within his work, Dr. Gopalan is also a certified in acupuncture and yoga and the author of Second Opinion, How to Combine Eastern and Western Medicine Philosophies to Increase Your Wellness and Healing Power, and his latest book, Survival, 8 Rules for Being Your Own Healer. Today's conversation will explore the topic of health through Dr. Gopalan's fascinating experiences at the intersection of mind, body, and spirit. Welcome, Dr. Gopalan.
Thank you. Thank you, Trixie Ann, for that kind introduction. I'm really excited to be here, and I'm going to start sharing my screen.
Wonderful. If you will introduce us to your 8 rules, and if you'll share a little bit about the inspiration for survival, and I hope you don't mind as we go through our 8 rules, I'd love to pop in with a few questions as well too. Dr. Gopalan.
Thank you. So I'll give you a little background. So I was born and I grew up in Sri Lanka, but I had I was fortunate enough to be trained in both disciplines, the Eastern and Western, at the same time as I grew up. Even though I grew up in Ayurvedic tradition, when I went to med school, I started learning the Western philosophies of medicine. At about the same time, I was also introduced to acupuncture and the Eastern philosophy of medicine, which concentrated more on energetic medicine and the spirit of the human being. With that concurrent study, I was able to adapt both and accommodate both in my mind. But more importantly, what helped me in questioning the human potential is the introduction to meditation and yoga. When I was asked who I was by the guru who trained me, and I had no answer. Ever since human beings, I just love observing, trying to understand how we function and behave. Throughout my career, through med school, residency training, fellowship training, and now as a practitioner in heart transplant, where I deal with all patients who are at their last stage of life. I've had the opportunity to observe how a human potential makes a big difference in the outcome of the patient's illness. And that's a fascinating area. I am continuing to be a student of that. In addition to being a physician, I love what I do in Western medicine. We provide the best options possible in this country, at least, to patients who have end-stage heart failure in my world, and I'm sure my fellow physicians continue to do the same in their respective specialties. But there is something else that is missing, and that is what was recognized as I grew into practicing medicine. So here I am, director of the program at Banner University Medical Center, and I'm very excited to be here with our audience to share my take on where the human potential can affect outcomes of illness. So with that, I'm going to introduce our audience to our talk today. Our talk today is going to concentrate on what I call health versus disease. And as we all know, we have lived through a pandemic in the past year or so. It's almost a year, a little more than a year. If I remember right, March 19th, 2020 is when Arizona State went into a lockdown and everyone was asked to stay home. It is at that time I was able to observe what did the pandemic show us. What the pandemic revealed is a very astonishing finding. It actually shed light on where we are focused. We focused on disease, we focused on death, we focused on how many people died. But what we forgot is how many people survived. So out of those people who contracted the disease, not everyone died. It is a fact that people with comorbidities, in other words, people who already had an illness, couldn't fight the virus as good as people who did not have the disease. But the surprising finding is the pandemic revealed 4 distinct groups of people. For example, there are those who got the virus. Obviously, people who were not exposed to the virus did not have anything. They are healthy. They didn't even know whether they are healthy or not, but they were not exposed to the virus, so nothing happened. But out of those people who were exposed to the virus, there's a group that did not even know they had the virus. They just didn't have any symptoms. And so they won the battle with the virus without even knowing they were fighting. The second group had mild symptoms, but did not have to go to the hospital. They had symptoms, they stayed home, they got better, and there they are. They survived the coronavirus, which was killing people in millions across the world. And strangely enough, it's not only crippled the medical system and the healthcare systems across the world, it also crippled the economic systems of the world. The third group of people who got the virus needed to be hospitalized. In other words, they did not have the ability to fight the virus by themselves. They required the resources of a hospital to get better. And then there was a fourth. So if you look at the third group, when they got better with the hospital resources, they were discharged. And I remember in our hospital, every time when a COVID-19 patient got discharged, we would play a nice music that told everyone in the hospital that there is a successful healing of a COVID-19 patient going home, which made all of us happy. And then the fourth group of patients who had the virus required hospitalization, but did not leave the hospital. Even with the support in a very industrialized, advanced country like ours, those patients cannot survive. So the question is, the first fact is that the pandemic actually shed light on that. We were not focusing on the people who survived. We were focusing more on the people who died. Every day on the TV, you will see what's the death tolls. I remember looking at the New York channel and what was happening when it was an epicenter, looking at the death toll every day in thousands, rising. And all the media, everything concentrated on people who had the disease and died. But it did not focus on people who survived. Then it raises the question, is what made those survivors survive? And the paradoxical finding is, even people who had comorbid conditions, high blood pressure, diabetes, and heart failure in my world, there are few patients who survived the coronavirus without even getting hospitalized with comorbidities. And on the other hand, I have come across patients who did not have comorbidities diagnosed, got hospitalized, and some of them did not survive. So there is a paradox, health versus disease. So there is something else that's affecting the outcome of a disease when you have to battle out a disease. What is that? And that's what made me think that we wanted to focus on health. We have mastered how to deliver disease care and make people better. It saves lives every day. And at our center, we continue to provide that relentlessly every single day to the best of our ability. There's no question about it. The question is, how about if we combine that excellent care with empowering the patient to do and to be their own healers, to generate the factor that was missing or that was responsible for those survivors who survived. How about empowering all the people? Why not? That's what actually motivated me to describe what health is, because what determined that outcome is the health status of those people who survived, not the resources. The resources we provided in the hospital was the same for every single patient. But it was not the lack of resources or availability of resources. It was the health status of those patients. And that is what we want to focus on. That's what we are going to be talking about, how our audience can make themselves, their health status optimal so that they don't have to worry about losing the battle when a disease happens. So as a result of that happened, the book Survival that you mentioned, a Physician's Guide to Battling Pandemic, Epidemics, and Disease, 8 Rules for Being Your Own Healer, which describes in a very simple format. And the format I have created is, if you look at most of the books, they give you contextual information. In other words, it gives a context and tell you my first book was contextual. But in this book, I decided because of the catastrophe that happened, it's time to empower each and every one of our patients and people who affiliate with us across the world. It's based on one simple philosophy. You give fish to a man, you feed them for a day. You teach someone to fish, you feed them for the rest of their life. The entire idea of designing this book in 3 parts, where it goes through 6 views, 7 concepts, and 8 rules, is the book actually contains information to understand what health is, and then a deeper understanding that actually combines Western and Eastern philosophies to understand the core message, or as you say, Trixie, the heart of health, is in part 2 of the book. And then part 3 of the book is 8 rules of how to be your own healer, where you can utilize what one learns in part 1 and 2 and then put it to work. On top of that, the book Second Opinion that was published in 2016 adds value to it in that it talks about the personality of the person. So I always believed in order to be healthy, it's not what you must do, but it's who you must be. It's the being of the person that makes the difference. And I have tons of stories, patient stories, that validates that notion. So that is the background. And what we are going to do, I'm very excited with the audience to share the 8 rules and speak in plain language and answer some questions and make them understand, get enriched with regard to how to start being healthy, so that we don't have to run around in fear when a catastrophe happens, and we will be prepared. We can hope for the best, but we will be prepared for the worst. So with that, here are the 8 rules to successful health. These are listed for the sake of the audience, so that they can have a telescopic view of what's coming in the next few slides. However, I would pretty much lay a foundation of what this means. Is health, as we know, is much misunderstood aspect. If you ask a young person in the 20s and ask, are you healthy? And they will say yes. And you ask them, how do you know you are healthy? And they will say, I don't have a diagnosis of disease. So, and if one looks at the dictionary definition, in fact, dictionary defines health as a well-being that's maintained at physical, mental, emotional aspects, and not simply the absence of disease. It actually defines having disease in the definition. So there's no wonder our generation looks for disease, presence or absence to determine if one is healthy or not. And the other aspect is physical, mental, emotional well-being. But no one understands what that is. Because well-being is a definition that is unique to every individual. And that's why the dictionary left it that way. But one has to determine what that is. No one teaches us. In school, we don't teach enough about health to our children. Colleges definitely don't, unless you go to medical school, then we learn about diseases and how to take care of them, not much about health. Otherwise, most of the information on health that I have is how I grew up. And I think most of us learn about health based on what our family, parents, and relatives, grandparents did. And we carry that over as adults and do the best we can. When a disease develops, we go to a physician, take medications or undergo surgery and hope that the disease is out of our way and it'll make us live longer and healthier. That it cannot be far from the truth. There is something missing. And the reason I say that is even best with the provision of best treatment that I have, my patients keep coming back to me. I don't want them to keep coming back to me. I want them to be empowered enough so that they don't have to see me ever. That would be the best case scenario. That's the ideal situation. How about we do that? How about we train and inform and develop ideas, research, and information and education for people to learn how to be healthy? Imagine the power when we combine that with the resources available. So success will be guaranteed if we did that. Mm-hmm. So with that, I'm going to briefly mention something about commitment. That's the first rule to be successful. Mm-hmm. So why is commitment important? Commitment is important. Because without commitment, nothing can be accomplished. Every one of us knows it. But we ignore it when it comes to health. Look at our lives. All of us commit to making money, earning a living, raising a family, making friends, having hobbies, and we continue doing that. Establishing relationships. These all require commitment. But what we fail to do when we are young is we never make a commitment to be healthy. Most of us. I'm sure there are people who make the commitment. I can generalize the statement, but most of us fail to make a commitment to be healthy simply because we are busy. We are busy trying to accomplish other things I just mentioned. A lot of us are busy trying to make a living. Entrepreneurs, other people, they don't have time, even if they made a commitment to spend on being healthy.
Mhm. Dr. Gopalan, could you share a simple example for me that I could start to implement that would demonstrate that commitment? What's something that's doable for myself or our guests right away that would help us to overcome that commitment obstacle?
If, for example, take for example, a simple question. Do you take 45 minutes, at least 45 minutes a day, to be by yourself and reflect on how your day went?
Mm-hmm.
Most of us don't do that. We are too busy running around, working, and then go home, doing home. I don't blame it. We live in a very fast-paced society.
Mm-hmm.
We don't do that. Once we start doing that, what you actually do is you're connecting with your true self, with your own self. That's an important thing. We are so distracted with external factors. We are not even connecting with ourselves. There's no need, or we don't see the urgency or the need to be committed to health. So that's one. The second question is, what I mentioned is, we just don't know whether we are healthy or not until a virus attacks us. That's when we find out, gee, I wasn't healthy. That is the surprise for people who did not have comorbidities. Young people who had coronavirus, they ask themselves, how did I get sick? I'm not supposed to. I'm not supposed to be in the hospital.
Mm-hmm.
I don't have any medical problem.
Mm-hmm.
But that's the strange thing. And it's not strange to me because, I think I understand it. It depends on your health status. You can be 75 years old with comorbidities and overcome the virus in a brisk if your inherent health is in good status.
Mm-hmm.
On the other hand, you can be young and may not survive.
Mm-hmm. Mm-hmm. Yeah.
So going back to commitment, I'll tell you, a patient story, which is as a physician, you see a lot of patients, you work with them, and you get them where they need to be, and that's what satisfies my day on a daily basis. That's why I come to work every day. I had a 62-year-old gentleman who had end-stage cardiomyopathy. He can walk. He was coming to the clinic on a wheelchair. His wife was pushing him, and he was swollen, and he was looking at shortened lifespan. He was looking at a little more than 50%, maybe 60% chance of surviving the next 2 years. That's a very low expectation. There's a 40% chance that he won't live more than 2 years. When you realize that, most of my patients really look within themselves. Do I have a motivation to live? What should I look forward to? But this gentleman proved to be what we call in medical world non-compliant. What that means is that he wasn't doing what we are recommending to the point we were satisfied. In other words, he was from a dietary perspective, he would cheat from time to time and then get sick and get hospitalized. Won't adhere to the diet that was recommended. Sometimes he missed clinic follow-up visits. As a result of that, when it came to being evaluated for heart transplant, he was told, you're not a candidate because you are medically non-compliant. We cannot give a precious gift as a heart to someone who is not going to keep that heart for the longest time possible. Mm-hmm. He was looking at a couple of years. One of the days, on one of the visits, we sat down with him, me and my team, and really shared what we felt about him. Instead of telling him what he should do and what he should not do, we really had a heart-to-heart conversation. Mm-hmm. In fact, what I shared with him is how I felt about his life, rather than letting the patient know what he's doing right and what he's not doing right. I shared that how we are worried that he doesn't have more than a couple of years to live unless something is changed.
Mhm.
For some reason, that day was a pivotal day for him. He looked me in the eye and he said, "Doctor, I'm going to do whatever it takes. Tell me what I need to do." So we went through the process of what is required to be eligible for heart transplant. That included physical rehabilitation and nutritional rehabilitation, which means you improve your nutritional status so that you can successfully go through surgery, and then you improve your physical status so that, again, your surgery will be successful.
Mhm. Mhm.
About a month afterwards, I actually ran into him in the hallways. I did not recognize him. He was in a pair of shorts walking by himself. I am never used to seeing him walking by himself. And he said, "Doc, I did what you said. Here I am."
Mhm.
Subsequently, to cut the long story short, he was evaluated for heart transplant. He successfully underwent heart transplant. Now he's looking at 80 to 90% chance of living more than 5 years.
Amazing. Doctor, leading into your rule number 2, I suspect you're saying this is not work we do ourselves. Tell me more about creating a team.
Creating a team is important in the sense, um, if you look at us, so if you look at the example I gave, he had a team. That particular patient had a team. He had a team of physicians, our coordinators, other providers in our heart transplant program who was helping him.
Mhm. Yeah. Will
In
you
addition,
show that great graphic from your book and go to your next screen? I know there's a wonderful visual that you have.
yes.
Oh,
So this is
rule number 2 on the
uh,
teams.
yes. Rule number
There you
2.
go. Thank you.
Here is the illustration of having a team. So when you do this, so he had us as medical team. He had his wife as part of his team. He also had his children who were helping him to be supported at home. So he had his own team. But what he did not have before he became sick is a team that took care of his health, not the disease. Our team is about we are taking care of his disease
Mhm.
and trying to get him back into the healthy status. There's nothing wrong with it. But what he missed is having a team before he got to that point in maintaining health and helping him be successful in delaying disease and overcoming the disease successfully.
Mhm.
If you look at it on a daily basis, we all have teams, right? We have a family unit that functions as a team. Parents, children, siblings, relatives, we function as a team in our regular life.
Mhm.
If you look at even as an individual, what you do, we go to the same spa, we go to the same nail salon, we tend to go to the same groceries, same gas station. Those are our team members. We take our car to the particular mechanic because we trust them. Those are our team members in general life. We have a team.
Mhm. Mhm.
But what happens is when it comes to health, people don't establish a team.
Mhm.
And what is the advantage of the team? Is the team actually teaches. In fact, if I take my car to a mechanic, I learn more about car and the repairing car and how to maintain it better every time I go there because they teach you what is wrong with your car and what you should have done and what you could do to prevent.
Mhm.
So team members actually continue to teach, which is something in health we lack.
Mhm.
We not only don't get taught about health in high school or in college, we don't have anybody teaching us continuously as adults. Where is the report card for health as adults? We don't have it.
Dr. Gopalan, have you seen where Banner Health and Banner University Medical Center has begun to work within these areas that you've identified as teams? Are there some innovations that Banner has made in some of these areas?
Yes. So Banner as an organization has recognized the importance of health and the importance of disciplines other than medications and surgery. We have acupuncturists in our staff who work with our patients. That is an Eastern philosophy that works through energetic balances. It doesn't give medications,
Mhm.
has no side effect, no measurable side effect, no downside to it. We have pet therapy. I have seen pets, except during the COVID time, we have pets going and alleviating some of the anxiety and other things that patients have when they are hospitalized because they are in a new environment. So if you looked at it that way, and then we have nutritionists, obviously most of the hospitals have nutrition services who is advising patients that are specific to their disease. And we have psychological counseling, psychologists. So the hospitals have adapted some of this, and Banner Health more specifically have acupuncture and pet therapy and music therapy and other things that help improve the well-being of the patient. But what my suggestion is, a patient or a person, in fact, before they become a patient, should have these way ahead of time. That maintains your health. That limits and eliminates a lot of stress-related triggers that cause disease. For example, hypertension. The association between stress and hypertension has been well established. That can be prevented.
Well, you're building our story here, Dr. Gopalan, and I know everyone would love to see more detail, and I'm going to remind everybody, we're going to post all of these slides on the landing page. So you're building the picture for us. We're committed. We're building our team. Now you want us to think about moving from the inside out. Can you move us forward to rule number 3?
Yes. So if you look at this, what this is about is a very simple philosophy. Let's face it, we live in a very toxic environment. Right? When I say that, we breathe polluted air. If you live in an industrialized country, that is something unavoidable. We eat processed food and food that are easily accessible because we are very busy. Right? So that this connects with the commitment. If you are committed to being healthy, we will pay attention to what we eat and what we breathe. If we are not committed to it, these things are not in our radar. For some, it is unavoidable. That is okay, because that is the reality of life. But what we can do is do something called, what I call cleanse, physical and emotional cleanse. Like, for example, if one wants to be living healthy, you have to continuously execute something called self-cleansing. What it does is makes you get healthy from inside out. What does that mean? What that means is that you are eliminating toxins from within your body. Let's face it, as children and young adults, our bodies are perfect as they are growing, and they can expel any toxins faster. But it is a fact, as we grow older, the body's ability to repair and regenerate, including eliminating toxins, declines. But what do we do about it? We don't do anything about it, right? So self-cleansing becomes important, and most of us don't do that on a routine basis. And what does self-cleansing mean? It applies to 2 areas, physical and emotional. Why is it important? For example, what does physical self-cleanse mean? It essentially means utilizing some detox programs to eliminate toxins like heavy metals. Heavy metals are present in water, deodorants, other lotions, and other hair products that we apply. And did you know that our skin and the hair and the root of the hair is capable of transmitting those and absorbing those chemicals into our bodies? And they get deposited in our bodies, but we do nothing about cleansing. We do nothing to eliminate it. As our bodies grow older, they become less and less capable of spontaneously cleansing them. Let's take it. We clean our house, we clean our car, we clean our clothes, but we don't clean our bodies, except exterior cleansing. Most of us, we take a shower, we take a bath. I mean, I'm not talking about those, but we don't engage in paying attention to the inside of the body. Those organs that are working so hard to keep us healthy are being bombarded with toxins. Let me spend a little bit on emotional cleanse. Why is that important? Because we live in a toxic environment. But the toxic environment doesn't only apply to food and air. It is also to what we hear. You hear negativity, you hear anger, you hear fear. For example, during the year of 2020, the entire world became a toxic emotional environment. We all know that. We know that the depression rates went up, divorce rates went up. These are all in the literature during COVID. Why is that? Because that's emotionally toxic. People lived under high stress and pressure. That's emotional toxic. And one has to actively and consciously decide, I'm going to do emotional cleanse. And how do you do that? You talk to someone, you talk to a psychological counselor. A lot of people get offended when I talk about emotional cleanse. They tell me, I don't need a shrink. It's not about not labeling us as a person with a psychiatric problem or don't know how to take care of ourselves. That's not what it is. We all know how to take care of ourselves, given enough time. But guess what? Time is a precious commodity that's not available in a fast-paced lifestyle. So we have to employ other people. So what I do, I pay money to spend with a psychologist just to cleanse myself. So you don't carry your negative attitude, frustrations, anger, and fear to the next day or the next week or the next month, allowing it to accumulate. Because we all know psychological pressures and derangements can lead to disease. That has been well described in literature. So that's what getting healthy from the inside out. But what I want to tell you, Trixian, is the most important, when you actually cleanse, it facilitates connecting with your own self. Somehow, barriers are removed that you are able to feel yourself much better. You have more energy, you sleep better, you feel healthy, you come up with better ideas. The very thing that we want to be successful in life is presentity. Most of us just don't do it in a routine based.
Well, now you've given us the mind, body, so I suspect you're bringing spirit next.
That is the, I think, if out of all 8 rules, that's the most important rule, is without the engagement of the spirit, you can neither maintain the commitment or maintain health. So this is a very strange concept. A lot of us don't think in terms of engaging the spirit. First of all, a lot of us don't think in terms of spirit on a daily basis anyway. We don't even think about it. We take it for granted. For example, like breathing. A lot of us don't think about breathing until we become short of breath. It's a spontaneous, natural thing for us. So it's the same way. We all have spirit, but we just don't think about it. But most of the time I get asked, what is spirit and how does it get involved with health and living and success? And there are stories, we can look at other things like religion talks about spirit all the time, but in medicine and health, how does spirit get involved? I just want to share a story with the audience, illustrating that the spirit is in fact in action in our lives, whether we see that or not, whether we pay attention or not. Spirit is always in action. Spirit is something that is always there to be discovered, but we just ignore it because we are too busy. We had a patient who got transplanted, and it's a young woman who got transplanted, and she did well. She was in her 30s. It's a few years ago. It did not happen in this institution. This is one of many stories I have. I just want to share one story with my audience. So the patient did well post-transplant, no problem, did very well, went home. But afterwards, she started complaining about headaches and blinding lights, a vision of blinding lights. So just as usual, but we evaluated her with CAT scan of the head, which is a radiological imaging test that you do to see if there's any abnormalities in the brain that could be resulting in this complaint. That was normal. We had her screened and evaluated by a psychiatrist. That was normal. Did all the blood tests and everything else that's possible under Western medicine. Nothing. Everything turned out normal. The young woman of 2 children, having these symptoms occasionally, that really was scary. Finally, we went and looked at the donor chart, and we discovered that the heart that she received came from a person who was traveling in an SUV at night on a highway and was a passenger who was involved in a head-on collision and was thrown out of the car and died on the side of the road by the highway. The interesting part about that is the memory of that person at the time of death, the traumatic memory, we think is embedded in the organ that was received. And in our literature, scientific literatures, we call that cell memory. Mm-hmm. The cell memory can be transmitted. But in the world of transplant, this is a new area that is being recently discovered and gaining popularity. Mm-hmm. But this memory from that donor heart is now manifesting in this particular patient. Mm-hmm. But what is more fascinating is the fact that the transplanted heart does not have any nerve connection to the recipient's brain. Because when their old heart is taken out, the nerves are cut. And most of us know, in majority of cases, the nerves don't grow back. Mm-hmm. So the transplanted heart does not have a nerve connection to send that memory to the brain, where the patients who receive that memory can recognize. Mm-hmm. Mm-hmm. So how did that organ transmit that message? And I think that is one of the areas we had questions. So there is a mechanism that exists that transmitted that message from the donor heart to the recipient's brain, where this particular patient was experiencing those symptoms. We don't have an explanation other than it's energetic. So energy transmission is the explanation right now. There's a lot of research ongoing in this as I speak, and we will come to know about it.
And there's a lot of interest in this, Dr. Gopalan, and unfortunately, we're going to move on to our next rule, but maybe we will follow up with more information. Fascinating. So we'll continue on and move us into rule number 5.
Rule number 5 is, if we want to be healthy, we want to be able to recognize change in our own health. If you cannot recognize it, you cannot remedy it. If you don't remedy it, you allow that change to continue to a point where it manifests as a disease. So it's recognizing change early. Now, when I, even myself was confused about this because I didn't know how to recognize change in health. But what it means is that on a daily basis, we function from about 5 levels. What the triangles illustrates is that we as human beings manifest different aspects on a daily basis. The P stands for physical level, physical manifestation. You go exercise, we walk around, we go to the gym, regular exercise, we dress ourselves, we look good, we look ourselves in the mirror. That's the physical manifestation. We do that all the time. The same way, we study, we understand, we use logic, which is the mental aspect of a human being. Likewise, we also feel emotions. We are scared, we get angry, we get frustrated, we get sad, we are happy, we feel love. So those are emotional manifestations. So behind those manifestations of a human being lies what I call intelligences that drive those manifestations. And below the emotional level is the spirit. It's a spiritual level of the person. There are days that you feel like donating or doing selfless service. You might be giving money to a homeless person on the street at the traffic light. Now, that point, that particular individual is actually manifesting their spiritual plane. We don't recognize it, but it's there. And the final plane, obviously, is you, which is unknown or universal, is a plane that a lot of people have a hard time grasping, which is unknown plane. I call it unknown plane, which is always there in us, but we don't pay attention to it. But we live it. For example, if when I go to bed tonight, whether I will wake up tomorrow morning or not is unknown. We just don't know it. Just because I woke up this morning, I expect to wake up tomorrow morning. But can you guarantee it? No. And that is the true case for some who don't wake up. But majority of us wake up. But look at the other examples we do. People read horoscopes. We are trying to predict the future because we don't know. It's unknown. There's entire discipline of statistics was developed based on trying to predict the unknown. It started with rolling a dice and gambling, and then we went to weather prediction, and now we use it in medical literature, economic literature, everywhere. Statistics pervade unknown. That usually begins to the spiritual world and our spirit. But those things that I have mentioned on the side are the ways that you can monitor your different levels on a daily basis to see whether you are maintaining an appropriate, healthy status of those levels.
Yeah. And Dr. Gopalan, there's a lot of interest in how do you engage in these conversations when you are interacting with your physicians and traditional healthcare, and how do you, what do you own, and how do you engage physicians in understanding your commitment to these levels as well too?
First of all, and I think first I try to engage the patient in this conversation, but you and I know that we are limited with time in a fast-paced medical practice, that I just don't have time to talk about these to the patients and physicians. So that it's strange that you asked me. When I came across these and I wanted to teach and discuss these with patients and educate physicians on this, there was a lot of resistance. And people were not interested. And first of all, they don't have time to sit down and talk to you about it, and because everyone's busy. And the second is some people haven't heard of these concepts and they don't want to know about it. That is when I decided. So I talked to a friend of mine, and this is what he recommended. He said, "You're talking to the wrong people and you're doing the wrong thing." And I said, "Why do you say that?" And he said, "Well, you are looking at a river that's turbulent and you are trying to walk through it to get to the other side. That's going to be very hard. You don't want to do that. But why don't we just build a bridge over it and let the people walk over it?" Out of that advice came the idea of writing the book. To send it to everyone, they can take their own time reading it, decide if they want to choose to adapt those or not. That's an individual choice. That goes back to the commitment I talked about. And then enjoy and be empowered.
Well, that issue of time is catching up with us, Dr. Gopalan. So I'll let you briefly reference our next three goals, and then we do want to hold time for a few questions at the end here.
Okay.
So I'll let you advance your slides for us.
Okay. The next one is renewing health. So once you recognize there is your health status is changing, the important part is to try and rebalance yourself. So in one of the concepts is understanding what health is. The health is actually an ability to rebalance and regenerate. That's what it is, which is a practical definition of health. If we can maintain that, we maintain health. So renewing health daily has something to do with whether we utilize health assets in our life or health liabilities. If we engage in activities that are considered health liabilities, we won't maintain health. On the other hand, if we engage in activities that are considered health assets, we can then rebalance and maintain health. What does that mean? How do you quantify? How do you understand? A health asset is an activity that puts energy back into you. For example, take food. If you are eating a healthy, nutritious food that is easily digestible, and compare that to a fast food that you buy, which is filled with oil, grease, and butter. All right, two different food types. When you eat a healthy, clean, less cooked, fully nutritious food, your body is going to spend energy to digest it and absorb it. That is a fact. Your body is going to do the same with the fast food. It's going to spend energy to digest it and absorb it. But guess what? Your body is going to spend more energy digesting and absorbing unhealthy, chemical-rich food as opposed to clean food. And on the other hand, will gain more energy from a clean food rather than an unhealthy fast food. Mm-hmm. So the fast food becomes a health liability, and a clean, nutritious food becomes a health asset. That, in fact, puts more energy back into you. It gives you more energy, even though you spend money digesting. So that's a very simple concept, and it depends on what you do.
Yes. And doctor, your next rule is what I refer to as your prescription. So I wonder if you would put that your full slide up. I call this the prescription that you're writing for all of us.
Yes. So essentially, it's, and then once you balance it, obviously you have to maintain it lifelong. Health is a lifestyle. It's not something you do for a week or two and then forget about it until the next year comes. It's not like creating a New Year resolution. It's a commitment to change the lifestyle, to continue to do it on a daily basis. If one wants to be healthy in body and mind, you have to engage the spirit. But if you look at this, I have put together a slide, it's very well described in the book, is how you can maintain health. It's about maintaining life flow. And that concept is described in the book. I'm going to briefly tell you, there are disciplines that one can use on the health aspect in addition to the disease aspect. If you look at the first row, regular disease screening is part of being healthy. You have to engage your modern physician and make sure that you screen for presence or absence of disease. There's nothing wrong with it, at least every month, every year. But in between those, what you do is what is described in this slide, where you can do several things, including physical cleanse every 6 months, emotional cleanse every 6 months, and then every energy balance every month. And it lists the disciplines one can use and the team members you have to be engaged in.
Doctor, the number one question seems to be, where can they get your new book, Survival?
Okay, so a couple of things. The Survival is scheduled to be released next month. So once it's released, it can be obtained at Amazon, Barnes & Noble, wherever books are sold. And it is also available on our website called Healthy Human. Mm-hmm. It's a healthyhumaneducation.com. Mm-hmm. And if you go to the website, you can actually pre-order the book. But more importantly, what I have there is a workbook that someone can download for free and start looking and have a pre-assessment of where their health status is, which will then empower them to learn and retain more when they read the book. Mm-hmm. So these are the three places that you can, Amazon, Barnes & Noble, and then healthyhumaneducation.com. And you can pre-order the book. And the second opinion is available at Amazon, Barnes & Noble, and also on our website.
I'll let you finish out our 8th rule, and then I have a couple more questions before we hit the 6 o'clock hour.
Okay, so recruit an expert advocate. And why is this is very important? When you are, either you want to be healthy or you have a disease, you want to have someone who's advocating for you. For example, mm-hmm. most of us don't go to courts without having a lawyer. But we don't seem to do that in medicine. Most of my patients get admitted. Their primary care physician, because of the way our system works, don't come into the hospital. They are informed of what happens to the patient, but someone else takes care of it. You acquire another advocate. This advocate doesn't know you. They meet you for the first time. So it's very important that every person, whether it's in health or disease, should have an advocate who knows them well. And I'll give you a very brief example. I had a 50-year-old woman who was very sick, was in the intensive care unit, connected to several machines supporting her life support. Her husband was by her side every single day and was watching her. After 3 or 4 days, even though she was, from medical expert perspective, was getting better, and we were getting to a point where we could take the machines off, but he doesn't see those machines coming off in a hurry. And he reached out to his religious leaders and the rest of the family members. And because the husband and the wife never thought that this will happen to them at age 50, they never had any pre-plans. After reaching out to those his relatives and people he can rely on, he really loved his wife and was looking out for the best interest. But he made the decision to withdraw support against medical advice, when we as physicians felt that she was getting better and can do much better. So that is a brief example where you really have to have an advocate, health advocate, who should have these characteristics. They should have the appropriate training. They should advocate for you, understand their limitation, and respects other physicians and specialties, and communicates with them and closely partner with the person and other specialists. That's very important. And that's my last rule. You have to have that's essentially are the 8 rules where you can actually be your own healer, to be among those people who survive in the pandemic without having to be hospitalized.
Doctor, because of your passion and your personal experience with helping to create that intersect between Eastern and Western, you are working with the foundation to create At the Heart of Health Fund here at the foundation. You want to talk a little bit about the aspirations for what that fund can help to do and help to make these resources more available to our patients and help to advance some of the research that you're in particularly interested in?
Absolutely. So this is what I'm excited about, Panna, is being interested and keenly interested in building a center that focuses on health, not just disease. Panna delivers best healthcare delivery, but we want to focus on health. So this center will focus on, with the funds that are collected, focus on advancing research and disciplines that the focus of those are mainly health. How can we improve individual health, provide education, and individual empowerment of individual patients? And that's the focus. So, for example, if through this center, one of the examples is we would be studying the cell memory transmission of memories from donors to the recipients. And we will start now collecting scientific evidence to prove what is it exactly that happens, that these memories are transmitted, and how to prevent that, or how to facilitate the recipients get used to it.
Thank you, Dr. Gopalan. You have taken us through a whirlwind, a very high level overview of your wonderful work, and it really is a very thrilling presentation. So I apologize to the audience. We know we could have given much more time for each one of the topics, but know that we are here and we'll be back doing this again. Tomorrow we will be sending out a link to everyone to connect back with the resources and today's program, as well as I promised the PowerPoint as well. Just as engaging in your own health makes a difference for you, engaging in philanthropy as a tool for promoting health in our collective community is a wonderful resource. So I hope that you will consider your role in helping to advance our work. And I have to also be sure to say congratulations, Dr. Gopalan. The Advanced Heart Failure Center just recently marked 1 year, a little over 1 year, with 21 successful transplants. You have 29 more patients on your waiting list, over 500 patient referrals, just a tremendous accomplishment in an incredible year. Thank you, Dr. Gopalan.
Thank you so much.
And I'm going to let you close with what your closing statement in the book that you've shared so beautifully. And it's both a blessing and a pledge.
Thank you. Yes, I mean, I think that is one of the statements that I close in the book, actually incorporates these 8 rules in that code. It's a code that I think, I believe everyone should probably have it to be successful, to remind them. And it goes, I commit to a lifestyle of health, by creating a team and adapting self-cleanse to engage my spirit, to recognize, renew, and maintain my health with guidance. So it touches on all those 8 rules, so that which is start with the commitment for success in health.
Thank you, Dr. Gopalan. Thank you to our guests. Thank you to our sponsor, Prisma. And please join us next month for this At Home Together series. Please stay in touch, and thank you, and all. Be well.